Hello, everyone, and welcome to the webinar, Aging Native American Rural Home and Homeless Populations, Engagement and Advocacy During the COVID-19 Pandemic. This has been organized by the Gerontological Society of America's Environmental Gerontology and Rural Aging Interest Groups. The webinar is being recorded and will be posted on the GSA website. A question and answer session will immediately follow the live presentation. We will be accepting questions through the question feature accessible on the right hand side of your screen. We also will be live tweeting this webinar using the hashtag GSA webinar. Please join us at Geron Society and at InventalGeroIG on Twitter. As we get started, I would like to thank Dr. Yarman Yee of the Environmental Gerontology Interest Group, Dr. Cassandra Ford, and Dr. Lynn Holly of the Rural Aging Interest Group for coming together and co-hosting this webinar. They've worked tirelessly to put this on. My name is Aaron Guest, and I am an assistant professor of aging at Arizona State University, and I will be serving as moderator. We'll be hearing from 3 experts in their respective fields today, focusing on how aging Native American, rural, and homeless populations are responding to the COVID-19 pandemic. We will hear from each presenter for about 10 minutes. Following these presentations, we are thrilled to present a moderated discussion with these experts, a rare opportunity to have representatives of these 3 communities in conversation. We will have about 10 to 15 minutes for questions at the end. Without further delay, I would like to introduce our first presenter who will be discussing Native Americans and COVID-19. Dr. Donna L. Polk has been Chief Executive Officer of the Nebraska Urban Indian Health Coalition since 1991. In this role, she oversees programs and services across the domains of behavioral health, transitional housing, primary care, suicide, meth prevention, the Tired Moccasins Elders Program, and transportation. Dr. Polk, thank you for joining us today.
Good afternoon. It is certainly my pleasure to be a part of this important conversation related to issues facing the aging population in many of our communities. I'd like to start by talking just a little bit about the people we serve. There are approximately 574 federally recognized tribes throughout the United States, and more than a third of their tribal members live off reservation, meaning that they are either in urban communities like Omaha and Lincoln, or rural communities like Wilbur and Gordon, Nebraska. Many tribal members do not have access to any services offered by their tribes, so urban programs like Nebraska Urban Indian Health Coalition provide important programs and services primarily related to healthcare. We were incorporated in 1986, and our funding source is still primarily the Indian Health Service. Next slide, please. Our mission is to elevate the health status of urban Indians and other underserved populations. Our vision looks at the future of our community and their needs: jobs, housing, healthcare, education, and economic opportunities. We regularly assess what is going on. Sometimes it's very formal with focus groups and questionnaires like you see here in the slide. Or most often it's with informal conversations. Some people might label it as gossip. However, it is a way of knowing immediately what's going on in the community: who's ill, who has grandkids moving in, who is facing evictions, who has Section 8 housing applications approved, and what policies that have been implemented recently are affecting their lives. Next slide, please. On the next 3 slides, you're able to see the services we offer in the 3 communities we serve: Omaha and Lincoln, Nebraska, and Sioux City, Iowa. You can see then, meaning what we offered before the pandemic, and what we offer now, since we closed our building in Omaha on March 13th. I want to call your attention to the Tired Moccasin Elders Program. These are our senior citizens. This is one of our most important programs. We consider seniors at age 50. However, I want to emphasize that in Native communities, everything impacts the lives of elders. Since COVID-19, we've witnessed more three-generational homes, meaning that we have grandma, sometimes grandpa, mom, and grandkids. This could be due to job loss, illness, incarceration, substance use disorder, abandonment, and death. And all of this has been increased since COVID-19. This often places an economic burden on the grandparent who tends to usually be female. So what have we done to try to address these needs? First of all, we have provided masks, gloves, hand sanitizers to our community, particularly focusing on elders. We have provided grab and go meals provided by the Eastern Nebraska Office on Aging. We have recently received funding through the CARES Act and the state of Nebraska to provide rental, mortgage assistance, medication assistance, utility assistance. We are negotiating with Zip Trip cabs to pick up our community members to take them for pantry pickups, COVID-19 testing, and other services where you generally have access barriers because you don't have a car. One of the most important things we're doing is to provide tablets and internet access to families, again, focusing on our tired moccasins. We intend to provide training on site with 6 feet social distancing and masks. And we have tables that are 6 feet long, and so we'll put a person at each end of the table. I purchased plexiglass dividers, and we'll have a meal provided, but it won't be a community meal, it'll be a take-home meal because we're not going to have community meals in our building for a while. I also plan to hire 2 additional behavioral health staff, a social worker for our clinic, and 1 clinical social worker in Omaha. The other thing that I do is I really try to check on my staff to make sure that they are not experiencing higher levels of anxiety because many of them are working from home for the first time. Some of us go into the building periodically, and I want them to know that I care about what's going on with them and I can help them work through the challenges. Next slide, please. In Lincoln, we're going to provide tablets to our elders who are on the diabetes registry. We have about 120 people who are diabetic, and the majority of them fit into our senior citizen category. So we will provide them with the tablets and do training so that they understand how to use them. We're also going to increase our public education because now that we know that the virus is being spread by community members, we want to make sure that people are aware that they must mask up and stay home if necessary. Next slide. In Sioux City, we donated $30,000 to the Ponca tribe to be used to provide food to the Native community. We determined that that was one of their biggest needs. The other one being a place to quarantine if there's a community member that is positive for the virus. And so we have provided them with funding to help them meet those needs. Next slide, please. I titled my presentation Resilience because according to Google, it means that you can recover quickly from difficulties. And also it means toughness, and we are tough. Primarily because in 2006, we developed a pandemic plan in response to H5N1, which was bird flu. And we have used that to develop current policies and procedures to cover everything from working from home to travel restrictions and what happens if a person leaves the community, and then finally how to reopen. We have contacted donors so that they know where we are with our capital campaign. We've used social media to keep the community informed. And as I said previously, we've looked at the mental health of staff to make sure that they're not being overworked, and that they know that they have access to an EAP program which existed prior to COVID. And I communicate with my board members, and I want to give a shout out to Dr. Lynn Holly. She's one of our valued board members, and I appreciate everything that she does, particularly during these trying times. Next slide, please. We come from a position of strength. We rely on our elders to guide us with their stories of different experiences they've had, how they came together with the common goal of making the community stronger. Final slide, please. This is one of my most favorite photographs. I happen to see these tired moccasins sitting in this swing. It's not a stage photograph. They were sitting there talking, maybe informally assessing the needs of the community or gossip. And I asked them if I could take their photo. And so I'd like to close with this picture because you can see the hope in their eyes. And I thank them for everything they have done and continue to do to make our program a success. Thank you very much.
Thank you so much, Dr. Donna Polk. As a reminder, please put any questions you may have in the question box on the right side of your screen. Our next presenter, Carla Fress, will be discussing the challenges facing our rural older adults in the time of COVID-19. Carla is the director of the Blue Rivers Area Agency and is the Aging and Disability Resource Center in Nebraska, and is responsible for a largely rural 8-county area where she has served for over a decade. She is a 4th-generation resident of the area and is guided in her work by her lifelong engagement with the community. Carla, thank you so much for being with us today.
Thank you, Erin. Thank you very much for having me. I'm honored to be here to have this presentation with the other colleagues that serve our elder clientele in Nebraska. This first slide shows that Blue Rivers is one of 8 area agencies on aging in Nebraska. My area is the extreme southeast corner. It's largely rural, and there's a lot of travel in between high population centers, which there's not very high. Beatrice in Gage County is our highest population at 12,000. Our mission statement that we rely on every day is to develop or support a system of coordinated and comprehensive services for older individuals that promote a safe, healthy, and independent lifestyle. Next slide, please. Our older folks that we serve in our area are very independent. They're the same as Donna had mentioned. They are the backbone of America. They're hardworking. They've been through the Depression. Some of them are fearful. Some are like, we've been through a lot. We can survive this too. Some don't have the fear. Some do. They do have a hard time. Some of them's accepting the help that we provide. We provide many services. Their world was the family members stayed at home, and they helped each other. So they are relying on us when their family not around. We become their family to help provide these services for them. Next slide, please. We are pre-COVID. Our folks have most of them have one chronic associated disease, mostly arthritis. And they need meals delivered, they need some social activities, respite, and their housekeeping. And due to the post-COVID needs, A lot of these have been suspended. We had to suspend our transportation. We have transportation in 5 of our counties that would take these folks to the grocery store and take them to the doctor's appointments. We had people step up. The only transportation we provided was complex medical issues, to dialysis and to cancer services. But we had staff step up. They have been volunteering and delivering groceries. They have been taking out garbage for folks. They have been taking folks to the doctor socially, safely, because these are their people. They want to be there for them, and they work for us because they truly believe in our mission and keeping these folks in their homes. We also had to suspend housekeeper services, and that is something that the people that receive this really do need this service. We are in the process of reinstating this with waivers in place and the understanding that there is a risk of contagion, and the family needs to be helping work with the client to help make this decision that, yes, this is important. We do need this service back in our homes. Families are stepping up. We have seen that, or post-COVID, they're stepping up. They're realizing that, you know, mom and dad do need this service, and there might not be a tomorrow for them if we don't help with that. So we have seen some of the circling of the wagons, if you will. Also, there has been more people that have made the decision to stay at home versus going into assisted facility or into a nursing home, and they're doing it safely because they're isolated in those places, and at their home they can at least make the call on what happens with them. If they can go out and go to the drive-through or go to a post office or what have you. Next slide, please. We do partner with the public health department. I've had to make a lot of calls to them in the past 3 months for advice and guidance, and we work with our state union on aging. And again, we've had to learn all new directives, all new guidelines. We've had to revamp our pandemic influenza plan. Our care managers were always in the homes of our clients. They have become the phone contact for these folks, making weekly calls to them. They have done personal delivery, so as other folks in our building and in all across our 8 counties. Our site managers have enlisted calling trees with all the clients, checking on people, doing well checks. Neighbors are noticing when people aren't getting their paper or what have you. So the communities, in these small communities, they are stepping up to the plate as well. We've seen that they are self-reliant, and they are relying on each other, and we are also in the mix of that too, because our services are just the home delivered meals right now, and we have the take and go meals, as Donna had referred to, which is really popular, and I can see that as a new normal post-pandemic, that there will be people like a drive-through that they will want. We had never done that before, where they drive up and they get the meal delivered and they go on and do their business. So that has been a change that I can see that as being a new normal. We have decided that we're not going to provide computers. We cannot do in-home instruction, and our Wi-Fi service in extreme southeast Nebraska is not always available, and actually in some areas around here, sometimes it's not very reliable. And if we were to set these folks up with our CARES Act funding now, and then after that funds go away, they've become used to these things, and we won't have the funds that will be available to replace and to keep on going with those services. So it just didn't seem feasible for us to continue with that. Next slide, please. We are funded in, our resources are many different things. Our Families First Coronavirus Act was our first funds, and that was strictly put into place with home delivered and care and our congregate meals. And then we had our Coronavirus Aid Relief and Economic Security Act. And then our original funds, which is all federal dollars out of our Older Americans Act funds. Our state is our Community Aging Service Act, and we receive state funds for our care management program. And also through the Nebraska Department of Transportation is state funded and it's actually federal funded as well. And we do receive contributions as matches from all the counties that we serve and on most of the large cities and even the smaller cities, because that is how our grants are funded through the Department of Transportation, showing that the communities care and want to have these services in their community. And they all do have a separate set of requirements. It's a lot of bookkeeping, a lot of detail. It's a lot of transparency. It's keeping track of where the money goes and what you've done with the money. We have a lot of monitoring from the state of Nebraska and from the Auditor of Public Accounts to make sure that our funds are being spent in the correct way, and that is designated for the services of our clients. And what happened when the governor declared the declaration of disaster enabled us to move monies around that we could, for instance, congregate meal money could be used for home delivered money, and Title 3B money, which is in-home services money, could also be used for meals, anything to help get the services. There were no restrictions per se, and allowed instant act upon where we could spend the money where it was most needed to give the best services to our clients. Next slide, please.
Great, thank you so much, Carla. Is that everything you would like that you were going to discuss today?
Well, there was something that we had talked about at the beginning, but I think that we can go ahead and talk about that later, or did you want me to touch on that a little bit?
We can move on to David's presentation and then we can discuss that at the end. Great, thank you so much, Carla. Finally, our last presenter today is David Nego, who will be discussing opportunities among homeless aging populations during COVID-19. As a reminder, please put any questions in the question box on your right. David is the Executive Director of the Curry Senior Center. Since 2007, David's been leading the charge to increase Curry Senior Center's impact on the lives of San Francisco seniors in need. During his tenure at the Curry Senior Center, he has launched new programs and expanded the volunteer base. Prior to the Curry Senior Center, David served as the Executive Director of Little Brothers Friends of the Elderly, where he expanded the agency's volunteer-based programs supporting homebound and isolated older adults. David, I want to thank you so much for being with us today.
Thank you, Aaron. Hello, Donna and Carla. Carla, I'm sorry I took your last shot there. I saw my picture real quick and went, whoops. Anyway, pleased to be here today. So the first slide, you'll see that really we're a homeless agency is our primary work, and we have an integrated approach to working with seniors here in San Francisco. Next slide, please. Our mission statement is that promoting wellness, dignity, and independence for seniors. I think many senior organizations have a similar mission statement. The important words are dignity and independence. Many seniors have taken care of themselves their whole lives and want to continue to do so, and they can't, and they're scared and they're shy, but we still need to treat them with dignity. Next slide, please. So our program is primarily a health center. We're a federally qualified health center, and basically all the other programs are centered around supporting the health center. We're in a sort of we're in the heart of San Francisco, or the civic center of San Francisco, or the Tenderloin neighborhood. A rather old term that I'm going to use because people know it would be a Skid Row, and so what that means is a lot of single room occupancy hotels. Most of our seniors are low income. Most do not have family. They moved here at some point and never moved back. They didn't have kids. They've outlived their friends. So essentially, we provide the health and everything else around them that they may need. We're three buildings right next to each other: the health center, dining room, and then all the support services. So we're able to hand seniors off to one another. The neighborhood is such that it's very dense, so we can walk to everything. Our healthcare providers make about 500 home visits a year. They're still doing home visits during COVID. You know, we have very strict, you know, protocols on what to do and not to do, but seniors who can't leave their homes or apartments do need to continue to get their health care in the home. And when I talk about seniors, we're talking about 55 and older. Next slide, please. So 2014, and I got here 2007 to 14, this took us 2 to 3 months to find housing in this dense neighborhood for seniors. And then 2015, I guess the high-tech industry moved to San Francisco and just really gentrified the whole neighborhood. So it takes us now 2 years to support a homeless person who may be staying in a navigation center, may be staying in a shelter, may be staying on the street. It takes us 2 years to actually get them housed. And so it's really fundamentally changed how we did our work. Next slide, please. And this is how the system was in the past. I was talking about there's a whole lot of different arrows on how to get people housing, and what it came down to is who you know, who had the access. There was really no formal lists, no formal process. However you can get somebody housed, you just went out there and did it. Next slide, please. And then in 2018, the city of San Francisco came in. It's a city and county, so they have it brings a lot more resources than if you're just a city. They put everybody on a list, and so you got to see where your senior was. I have tried to move people up and down the list. You can't do that, but that's sort of how we got into the current system. And then COVID happened. Next slide, please. So similarly, early mid-March, shelter in place began in San Francisco. So the shelters and navigation centers was housed about 3,000 seniors. The city went to the shelters and navigation centers, said we need to put in social distancing. So they moved the seniors and vulnerable older adults to hotels, campgrounds, and trailer parks. And at the same time, the San Francisco's tourist industry collapsed. So I just want to point out that these hotels are really tourist hotels. This was sort of a I scratch your back kind of thing, meaning the tourist hotels were empty. So they were filled with about 1,900 seniors and vulnerable older adults. So what is the good part about being in the hotels? You know, they're nice. If you're living in a shelter, now you have your own room. You got a bathroom in your room. There's services down the hall. There's a nurse not on every floor, but in every building. The challenge is that since you're not in a congregate setting, if you have any health issues, if you have an emergency, you're in your own room, and it's hard to get out. I will say that one of my children actually works in one of these hotels, and one of his jobs is to knock on the doors, depending on what floor you're on. If you're if you're really ill, then he knocks on the door every hour to make sure you're awake, to make sure that you're there, to make sure you're healthy. So there's a lot of social interaction. So our other big source of homeless seniors was the medical respite. Essentially, these are people that are discharged from the hospital. And so now, due to COVID, we can't go and see them. So the only way we can interact, paperwork, get your finances, the only way is we actually have to send a cab to transfer you to our office. So this COVID's really impacted our interaction with seniors. So next slide, please. So essentially, 80% of our services has remained open. Essential services, you have to stay open, but of course, with social distancing and cleansing, everything is scaled down on how many seniors we can see. The health center has a very clear directive. We don't want to see you. You can't come in here unless you get sicker by not coming in. I'm not a medical person. but that's our medical director's comment. So we do have a lot of escorts. We do have a lot of Uber. We use a lot. And a little bit farther down the page, you'll see social programs and health education. We had 4 to 5 parties a month. We have groups every day. We have none of that anymore. It's really been difficult for a lot of seniors who really look at the social interaction. I think, as the other presenters have mentioned, you know, trying to get somebody a tablet, trying to get somebody a computer in the home so they can stay connected is extremely difficult. It's expensive. It's hard to teach people when you're not in person. Who's going to pay the monthly Wi-Fi bill? So it really becomes a challenge. And then I think my last slide, please. Next slide, please. So the staff is constantly coming to me and say, Dave, how are we going to open up? So, you know, we're between a rock and a hard place. You know, we're waiting for the city, the health department to give us some guidance. Meanwhile, I have seniors who have relied, you know, 200 to 300 seniors a day. I only have 50 coming in now. They really want to be involved. So the guidance that I give our staff are essentially these 3 points. We want to maintain engagement with people. So if they have phones, Wi-Fi, tablets, they're kind of functional. They are our highest end. We don't want to see you. We don't want you to come in here. You need to stay at home. We'll do everything we can to support you. Then sort of on the other end, the homeless seniors, who are what I call basic support, they're in here all the time, every day, trying to help them with paperwork, trying to help them sign up for things. So there's a significant amount of work. And then there's sort of a group in the middle. Again, we want to keep people safe. We want to keep them in the home, but they need to move forward with getting housing. They need to move forward with getting services. And a lot of times you need to do that in person. Anyway, I appreciate the opportunity to present today and look forward to questions.
Thank you so much, David, and thank you again to all of our speakers for their wonderful presentations. As a note, please type and send questions using the question feature in the dashboard accessible on the right-hand side of your screen. We will not be using the raise hand feature today, and we'll do our best to address all of the questions during the time permitted. I just want to say thank you to our speakers again, and what makes us so excited about the webinar today is this opportunity we have now to have you three in conversation. You know, to start off, I was wondering, you know, is there anything that you would like to react to from the other presentations today, or anything that you would like to add? And you know, I'll start with Donna, because we were actually having a conversation before things started about something that happened to her today. So I will, Donna, if you're available. Not Donna, I'm sorry, Carla. Carla, yes. Yeah, my apologies.
That's okay. Yes, I've been running all day. I had a call from one of my staff at the local center here in the town where our main office is, and a staff member came to work and wasn't feeling well and knew that her daughter was showing some signs of the COVID virus and was getting tested yesterday. But she came into the facility and started working, and then told my cook that, you know, I don't feel good and my daughter's getting this test. And we have drilled down and drilled down, do not enter the facilities. And so I had to find guidance to make sure that I was doing all the proper things. I had to send her home and tell her she needed to get a COVID test. I had to tell my other staff in the building that, you know, you need to self-quarantine, and in a few days you need to have the test done yourself. And so I called our local public health department just to make sure, because we have to follow these guidelines, and they agreed. They took the name so that they can be watching for that. It's in a city-owned building, so I had to make the call to the city, because Other city employees are in and out of that building as well, doing maintenance with the fire alarms and such. And that was a tough call to make to our mayor of our city. And also I had to make calls to my state unit on aging, who is the funnel director of our funds, and make that call. And then we had to figure out, okay, how are we getting these meals to our 50 clients here in Beatrice? And so that was talking to another place that serves meals here for our services, and if they agreed, and the people here in our main office building will be doing the packaging of those meals for the next 2 weeks, because these people will be quarantined until August 5th, and we will be doing the delivery of the same meals. So we had to make a lot of decisions today. So if I sounded a little zoned out, I've been doing my job, what has been the new normal for all of us. But this is the first time we've had to close a center, and just you have to stay calm, and you just have to move on. You have to be the calm one and the clear thinker. And I have great staff in this building that step up to the plate every darn day and are willing to always help out. We have the calling tree going to find out how many more, who's going to be getting a meal in the next several days. And so it has been, it was putting our disaster plan that we rewrote together and watching it come to fruition, and to know that we were prepared. We had these thoughts in the back of our mind, we've written them down, and so we have to I know that we're going to be updating and reviewing guidelines all along from here on out. I also had to make the call to my boss, the governing board member, chairman of the board, and he's like, you're doing everything right, just keep it up. And there's just a lot of calls to make when you have these issues, but we want to keep my staff safe. I want to keep all of the clients safe. There would have been no contact between the clients and the person that could have the possible exposure to COVID. So I'm thankful for that after talking with the public health. So it's been every day is a new learning curve here, and the safety is of the utmost concern to all of us. So we have no desire, we will not be opening up our senior centers anytime soon until this thing flattens out and there is not so much exposure risk for our folks. So yes, that's been my day today.
Thank you so much for sharing that, Carla. Donna, is there anything that you would like to add on?
Oh, yes. Thank you very much for this opportunity. I know we have a very diverse group of listeners, and I'd just like to offer two things, please. For our academic community, if you could do everything possible to encourage Native students or people who have that interest to do quantitative research, we desperately need more information to guide us in what we do, and particularly looking at kinship in the role of grandparents in terms of raising children and whether or not they are capable of doing it financially, educationally, and physically. And then the other thing is we should also prepare ourselves, those who are behavioral health scientists or even in the medical field, to help people as we hopefully come out of this pandemic experience. In the Native community, we have a lot of ceremonies, a lot of cultural activities around death and dying that can no longer take place because of the pandemic. And so we need to make sure that people who may be experiencing historical trauma, PTSD, high anxiety, and with our children, suicide, which is a huge problem anyway, make sure you are aware of what you as an individual or collectively can do to help us with those things. Thank you very much.
Thank you. David, is there anything you would like to add?
Well, I just both Carla and Donna, I'm going to tell you what things just popped in my mind. And Carla, I hate to use you as an example, but I'm going to tell my staff, because I have an all-staff meeting tomorrow, because we constantly drill down that you need to follow the rules. And you know, if you're sick, don't come to work. So, and we talk about it incessantly. So I am going to share your unfortunate what happened to you today, and just as a reminder, because people forget, we're all used to habits. We all have them. And I walk down the hall and I see people without masks, and they look at me and they hide. Well, they should. And so it's just reinforcing all the rules. And the thing is that we've never really shut down, and we know that if we enforce the rules, we haven't had any exposure here at the organization so far. And then Donna, I think you just brought a real important point: the cultural ceremonies. Our senior center has been spending time calling, checking in, just more or less touching. But so much of our work in the past was celebrations, all the different seasonal things that come up, and we haven't done that yet. So I'm going to take away and share with my staff that how do you have a cultural celebration on Zoom? How do you do that? And maybe it's something to focus on in the future.
Thank you so much. Oh, go ahead. Please respond.
Okay, I just wanted to say that they're having funerals on Zoom now, and then in the Native community they're doing social powwows since we can't come together for that. So there are some options, and so I know what you're going through, and I'm praying for both of you, and you both did excellent jobs. Thank you very much.
Thank you so much. We're actually getting quite a few questions in. I think obviously the COVID-19 pandemic has been a great challenge for all sectors. I think one of the things that you all kind of discussed in your presentations is that even in the best of times, we have challenges with three populations and having, the resources available. In your experience, has this delayed would you say this has delayed your responsiveness to this pandemic, or has it made you better able to respond? And we can start with David, I guess, going in reverse.
You're saying access to resources? Is that what I guess I misunderstood?
Yeah. I think some of the questions are these communities often have a lack of resources available. In the best of times, a lack of funding. I think in your example you shared, there's a lack of housing in some ways.
Right. Well, so on the one hand, I gave the example of the tourist hotels. So for people that don't have homes, just to keep, and they're in shelters, to keep them separated from each other. So that's a good piece. The challenge with a lot of our homeless and low income seniors is access to a cell phone. We're pretty cell phone driven here, or any sort of internet activity. So even our housed people, they don't have access to this stuff. They can't order food and have it delivered. They don't have friends that they can, and they don't even know how to use the internet. So when all your socialization has been in person, and now you're scared to leave your room, that is the isolation, I think, is going to be one of the bigger pieces. People are so afraid they won't leave the room, even if I'm going to send a staff person over to escort you. So I think if you have a family and you're able to, or you have neighbors that you're able to connect with, I think that's a great thing.
Thank you, David. Carla, do you have anything you would like to add?
David, I can appreciate, wow, you have obstacles there they don't have the resources to get a cell phone. That I can appreciate that's a huge challenge for you, and thank you for what you do for those folks. Our folks all at least have the capability to call somebody, and I hope they don't take that for granted. I certainly won't after listening to you, but we did have resources available right away. The federal government, we had the EPSLA money, and right away we had the CARES Act money and the COVID First Relief money, and so everybody stepped up to the plate, and we knew that we could keep offering services, and that was such a relief. And just going from there, and then when you speak to the isolation part and the loneliness, we have had to deal with that. That's why we do our weekly well checks on the phone and the calling tree. And actually, I was on Nebraska Forward yesterday with News Channel Nebraska talking about this same very thing, trying to address the isolation program or the problem in our seniors, because it is huge. And they're more isolated sometimes in the nursing homes where no family can come even see you except through a window. So it is a real problem and something we're going to be continuing to address here for many months to come, to make sure that we maintain the mental health of all of our staff too. I appreciate Donna bringing that up. That's a great point, and that is something that I really do want to look forward at most of our employees, because they've been working this whole time and we've all been doing, and we do need to check ourselves and make sure that everybody's mental health is on target and people aren't down. And I do appreciate this discussion with you other two individuals with new perspectives. It's really been eye-opening.
Thank you so much, Carla. Donna, same questions. How do you feel about resources that have been coming in? Have they helped you, or have they hindered you?
Well, I look at this as if the creator said, I'm going to just take a time out and you all are going to do things you should have been doing all along. So one of the things the federal government has done has been to suspend a lot of useless and barriers to functioning. If you got money, you had to write 30,000 reports and call this person and justify this. Now they're saying, let's just do this. And to David, I say, just imagine if we had been always housing the homeless. What if we'd always been feeding the poor and providing communication access to people? Some people don't want it. They don't want even a flip phone. But so I say that it's been easier for us to do the things we always should have been doing. And again, it takes leadership. And for that, I have a board of directors that are so open to new things and visions, and I appreciate the ability to do the work, provide the leadership that I was hired to provide.
Thank you, Donna. We're getting a lot, we've had a couple questions about technology, and you've all discussed technology in different ways in your presentations. This question is specifically, we've talked a lot about how some populations are more connected than others, but what do we do about assisting people who are either having a hard time using technology or don't have access to technology, especially when technology is becoming the only way we can connect them to local resources? And David, I'm actually going to throw this to you first, because I think this is something you've been experiencing.
When I can't remember, whether Donna or Carla mentioned that they get frequent audits or visits by the state or grant government entities to come in and ask you questions about how things are doing. So I've told my staff, I say, when you have an audit by the city or the state, you need to be ready. If they say, what is there anything else you need? I tell the staff, well, you need to have a job description ready. So my answer to your question is we have a job description ready, which is essentially somebody who can go in the home and sit with a senior and help them figure out what button to push. I hit this button, I don't know where it went. I tried to pay something, where'd the money go? A lot of seniors who don't have family around, they need constant reinforcement and constant training. You can't teach somebody the technology in 1 month or two. We have a 6-month training program. So we call it the in-home geek squad here. And that's, I think, what we feel that we need, somebody who can go to your home. And this is probably not in the time of COVID. COVID sort of clouds everything, but really that can hold somebody's hand to help them, so when they hit the button, they know where it's going.
Thank you, David. Donna, I believe you have a program that's kind of doing some of this work. Would you like to comment?
Yes, absolutely. First of all, we have 4 computers that we have had in our building that people could come in and do job applications, because much of that is done electronically. So we tried to introduce people to the concept of you're going to have to use technology and we will help you. And that's why now I am negotiating with AT&T, Cox Cable, and CenturyLink to say as much money as you make off of me and everybody else, you need to help us by giving us discounted access to internet. Then I went to a foundation and told them what I wanted to do. And they said, okay, we'll give you enough money to pay for 40 connections for a year. Now people will say, well, what happens after a year? I don't know what's going to happen. I'm talking about the right now. So if somebody can have it for a year, right now, that's when they need it. And we're going to do the training and we're working it out so that we can do it safely. I'm not comfortable having people go into somebody's home to do it because I can't regulate that. But I know what our facility is. We've had it sprayed down, we have it wiped off. I mean, everything we can do to eliminate transmission of the virus. So that's basically what we're doing. And if anybody wants to contact me offline, I know that the association, the Gerontological Society, they have our contact information, and feel free to do that.
Thank you, Donna. Carla, would you like to add anything?
I'd like to add that, yes, our care managers and our service coordinators, they help people that prior to COVID, they would help them do their Medicaid reviews in their homes with them, because it is confusing for people. They have a hard time with the online. So now it's a challenge. They have to help them over the phone. And so it is a challenge. They're getting a little better at it. And all of our senior centers and our bus offices all have internet access, which we pay a good price for, Donna, and I'm going to try to see if I can get that price reduced. But we allow seniors to come in and use those if they want to do Access Nebraska or anything, like you say, in any kind of an application. But that has been a challenge because with everything being closed, they're on their own. And so we hope someday that we can get back to where we are able to help them with those items.
Thank you all for that. I'm going to try to combine two questions. And I think what these two questions are getting at is, what have you discovered what do you think are the best practices for reaching out to these communities, engaging with the communities, and getting them resources, especially those in these communities who may be homebound or even in nursing facilities that we can't get to directly. Donna, I'll start with you. Donna, you may have gone on mute.
I'm sorry. Okay, I'm very lucky that I have staff and current staff and former staff that I can rely on, to keep me informed of what's going on and what the needs are. And so that was your question, Erin? I forgot.
Yeah, no, I think the question was, how can people in some of these in these states and areas, I think this one's coming from Utah, that, have native populations or rural populations, but the organization doesn't have connections now, but they would like to.
Yeah, well, collaboration is the key. And I know at the University of Nebraska in Omaha, they have really put the focus on collaborating, getting agencies and organizations to work together. So in Utah, I know in Salt Lake, there is an urban program and there are tribes there. The Navajo tribe, of course, is on one of your borders, and I think the Utes. So it's nothing wrong with contacting them and asking to talk to their community person. And that would be my suggestion, because we don't know everything and we don't know everybody, but we know somebody that has a connection. And that's what's so important at a time when we're working from our homes and our resources are very, very limited.
Carla, would you like to add something regarding rural questions? Populations, I'm sorry.
That's okay. I would like to add that our site managers at all of our facilities keep in constant contact with their clients, and they will tell us when there's a need. We try to reach out as much as we can. But these local people, they know what is going on in their communities better than we can, and we rely on them to be our eyes and ears. And I also rely on my colleagues across the state of Nebraska, the other 7 area agency on aging directors, because we have monthly meetings and we discuss topics of all sorts, and we do a lot of collaborating with each other and trying to help each other out with issues that may come up in our area. And I rely on them very much. And so collaboration, I agree. You gotta have the discussions and the conversations and people that you can rely on.
Great. David, do you have any thoughts?
I just something that Donna said, and Carla as well, but if we have 2 different staff or 3 different staff, a medical provider or case man that have a relationship with the senior, what we do is who has the best relationship. Because sometimes you don't like your doctor, and sometimes you don't like the person that escorts you, but our focus is who knows them the best, who has the best relationship, and let's just focus on that.
Thank you. Well, we have actually received more questions than we have time for, but I want to give you all an opportunity to provide any closing statements. And I will start with Carla. Would you like to provide anything as we close out today?
My closing statement is I'm very thankful that this was put together by the Gerontological Society. It's very important for people to discuss our issues across this whole United States and keep on talking to each other, look in on your neighbor, take care of each other, take care of yourself. We are all going to be having a new normal, and it's all going to be decided by each and every one of us, I believe. So that's what I have, and I wish you all a good day.
Thank you so much. Carla, would you like to provide any closing thoughts?
Aaron, you've been calling me Carla all day.
I am so sorry. Donna, oh my goodness.
I didn't know her before, but I like you, Carla. So,
but you have your own name.
Thank you very much.
I want to say it's just important for us to look out for one another. I can't tell you, the need for that, and to see if people are lonely and what can you do. Even a phone call would help. We can't all provide a lot of resources that you've heard us describe today, but just looking at somebody in the eye above your mask and smiling at them with your eyes could maybe be a life-saving gesture. So thank you for this very important conversation, Aaron and Gina, and I appreciate this opportunity.
Thank you so much, Donna. And David.
Well, I got a lot out of this, even though I think we were part of this to share information, but I got a lot out of it. And one of the things that I want to focus on is just the importance of working with staff, and supporting staff. While we're talking about seniors, we really don't do the work unless the staff, I suggest to the staff that we're really working at 80% capacity. Just the COVID has thrown us so out of whack, and it's so new that we can't really do all the things as quick or as easy because so much is new. And that it's okay to go slow, and it's okay to talk things through. Because the most important thing is you need to be comfortable doing your work, because once you're comfortable, then you actually can do your work better. So I have a lot of people with a lot of nervousness about how to work in the new, but we plan to take a lot of time with them so that we can support them and then get the work done. Anyway, I appreciate being part of the group today.
Thank you so much. Well, let me just say this has been a thought-provoking and delightful conversation today, and I want to say thank you to Donna, David, and Carla again for taking time out of their busy schedules in the midst of, what is a pandemic. I know we're all giving you virtual applause right now. I want to thank the Rural Aging Interest Group and the Environmental Gerontology Interest Group for co-hosting this event. I would encourage you, if you are not engaged in either of these groups, to become engaged for similar programming in the future. We will be continuing this conversation on GSA Connect, and I encourage you to engage with the discussion there, particularly if you had a question we were unable to answer. The presenters have provided their email addresses, so please feel free to follow up directly with them as well. Just a reminder, we are recording this session and the link will be posted on GSA's website soon, and you will be able to download a copy of the presentation slides from the website listed at the bottom of the screen. Please know our webinar survey will automatically launch after the webinar. In an effort for continual improvement, we would like to hear your thoughts. Please provide feedback by clicking the survey link at the end of this webinar. Once again, thank you to our participants. Thank you for everyone joining us virtually. And thank you again for participating. This is the end of the program.